So today is February 15th of 2022, and I'm here with Dr. Rai. And if I could hand it over to you to kind of introduce yourself and tell us who you are and describe what your job is.
I'm in Phoenix, Arizona right now. I practice in Glendale. I work in two community hospitals, Thunderbird and Abrazo Arrowhead hospitals. And I've been working there now for the last 20 years. So I've been there since before the pandemic and now during all this. Um, I have I have been involved in the care of patients, mostly inpatients, though I do some outpatient work as well.
Wonderful, wonderful. And then kind of looking back to the year of 2019, what were you doing then? And then how has your role shifted at all to kind of assist with the pandemic response as COVID began to kind of spread in the spring of 2020?
Okay, so when we first started getting reports from China way back, early 2020, we really didn't know what to believe. We were quite skeptical. And to tell you the truth, most of us did not think that our life would change the way it did. At that time, there was when we first started hearing about cases. We had the first patients that were admitted to New York City, and then there was an outbreak in Seattle at that time. There was a lot of fear, and it was fear of the unknown. A lot of our patients who needed care in the hospitals, they stopped coming to the hospital at that time. There was a lot of, and there was a lot of fear in the sense, you remember those days when we really didn't know, how the virus was spread or what were reasonable and not so reasonable precautions to take when people used to, leave their Amazon parcels in the garage for 3 days before they brought them in because they didn't know, what was going on. So if you can imagine that scenario, compound, multiplied by 10, that's what was happening in the hospitals, because after all, people working in the hospitals are human, and we would have COVID patients come in, and you really didn't want to put yourself at risk and want to take the virus back at home to your family. I mean, that was a very real concern of everyone. During the early days, all the infection control policies were very strictly followed. People, whatever masks you can get, and we're not going to go into the mask controversy, and full isolation protocols. A lot of people bought their own facial shields and their own self-contained, especially the respiratory technicians and the intensivists had these hoods that they would wear, to the patients' rooms and stuff. Again, it really seemed reasonable at that time. A lot of protocols in the hospitals that dealt with the COVID patients got revised. Like if a patient needed an MRI during those days, they would really think twice. Do you really want to take the patient for an MRI and then have to terminally clean the machine afterwards, Or if a patient needed an echocardiogram, we would really ask, do you really want the echo tech to be exposed to the virus, because you have to be in close proximity doing the procedure. So a lot of that stuff changed at that time. And then gradually, as our fear lessened, as the vaccines came and as the therapeutics came, and then now with the Omicron, which we think is not as deadly, all that stuff is slowly, it's ebbing away. I mean, people are getting a little bit less cautious. They're more comfortable taking care of the patients, some of the procedures, to give you an example, like early on during COVID, we had visitation policies, which now, if we look back, we think were pretty draconian. I mean, family members were not allowed to visit their relatives if they had COVID, or were not allowed to visit the relatives, period, if they got admitted into the hospital at that time. So now all that is getting relaxed. We have one or two family members coming in. Some of the hospitals have policies that the same family member can stay in with their loved one for most of the day. Some of them have more relaxed, less relaxed, depending upon, is the patient in the ICU or not. But I mean, all these policies have changed tremendously over the last 2 years, and they have evolved as they naturally should. you know and this has been good both from the patient standpoint and from the provider standpoint and from the caregiver and the family standpoint of the patient as well. uh, I can go more into the human aspect of it if you want me to. Like, I mean, think about it, Emily. Like, if in the middle, in May 2020, we had this huge outbreak, May and June, in Phoenix and Arizona, of COVID. And at that time, if a patient is not doing well, they come to the hospital and they're admitted. And other than updates that are given over the phone, or if the patient is FaceTiming with their family, the family could not even come and visit them. And if the patient doesn't do well, so from the floor, they're getting moved to higher level of care, they go into the ICU, and then boom, like 3 weeks down the road, you're actually talking to the family member saying, you know, it, nothing's working, and it may be time to withdraw care. Now, the family has seen their family member, how they looked when they dropped them off at the hospital. Think about it. It was just tragic and heartbreaking. Then to say, no, you can't come and visit. We're going to, or that it's time to say goodbye over the phone. Or, I mean, yeah. So all that has slowly evolved. People are getting, you know, uh, the care has evolved, and it has evolved because the virus has evolved, because of the vaccinations that have come in, because of the therapeutics that are there, because a lot of our population is now immune to it, whether from the natural disease or from the vaccine. So yes, so things have changed. A
Yeah, no,
long-winded answer.
yeah, no, that was a wonderful answer. And it's so important to hear about these different aspects. Like you mentioned, also the human aspect and the family aspect of what happens when a family member is ill. So it's very interesting to hear your perspective on that. And then if you could kind of describe more about your role in terms of infectious disease, and also maybe speak a little bit about how I know you mentioned things have changed there, throughout the last 2 years, there's been a lot more research developed, and from kind of that medical perspective, new therapeutics, vaccines. So I'm just kind of intrigued to hear your perspective about how, kind of as the science has shifted, any perspectives you have on that.
Sure. I mean, when we first, way back, now it sounds way back, about 2 years ago when we first came. I don't know if you remember, at that time, we really didn't know whether Plaquenil or hydroxychloroquine might be helpful or not. That was incorporated in most of the regimens of the patients as they first got admitted. Along with that time, I must say the US government has done a very, very good job because of making the medication so readily available. In March or May, by May of 2020, remdesivir, which was one of the first antivirals to get or approved against COVID, that was being sent to the hospitals. And in summer of 2020, that medication was available to us, but the allocation was small. And during those days, we used to have daily phone conferences, and we used to present our patients over the phone, to one of our CMOs in one of the hospitals. And he would say, we got a shipment of like 5 doses, which patient would really benefit from it, kind of try to triage it. So that was remdesivir as it slowly came. Then early on, we were using a lot of convalescent plasma, again, because we really didn't have anything else. Then studies from UK started coming that, Decadron was really helpful. That got incorporated. I am really impressed, and kudos to the government, to the CDC, and for everyone, that the therapeutics came. They were not only developed, but they were made available, to the hospitals. to the community hospitals, not only to the research hospitals, but to the community hospitals like the ones I work in. Soon after, remdesivir started getting readily available. And then I don't know if you remember when President Trump got COVID, he got the monoclonal antibody, right? At the time when he got the monoclonal antibody, that was thought to be like, it was the president, he got it. But now if you and I walk into the ER, and we are high risk and we fit the criteria, we would get the monoclonal antibody. I mean, that is the beauty and the blessing of our healthcare system. It's not going to be the same monoclonal antibody because, again, as the virus has changed and various mutations have come along, I mean, kudos to the health industry. The monoclonal antibodies have changed as well, and what's available has is gradually evolving. It used to be bamlanivimab, then the Regeneron product came, and now we have completely two different products that we are using right now. So that changed. Now the latest that's out there for us are the two oral antivirals that are available. And again, when they were first rolled out, it was said only the sickest patient should be given that. And those were patients over 70 or patients at very high risk. Now, a few weeks ago, they said, you know what, we have enough supply. So patients over 50 can start getting it. So again, I mean, that has just brought so much hope into the system. The vaccines are readily available. The monoclonal antibodies are getting more available. There's just more hope and more therapeutics now than there was before.
Yeah,
So,
yeah, of course. And then kind of looking at how there's been numerous different variants and numerous different waves of the pandemic, especially in Arizona, where you see, different data showing a lot of ups and downs. How has that kind of looked for your job, and how has that maybe looked in the hospital?
the Arizona is unique. We are fiercely independent in our thinking. And because our vaccination rate is not as high as it could be, nationally, I think the death rate is like 1 in 375 in the general population. In Arizona, our death rate has been higher than that. It is like 1 in almost 250 to 275, depending upon which numbers you use. And it in Arizona, it has been tougher. The vaccine uptake has not been as good, But again, if the vaccine uptake is not good, once the patients come in, there's other therapeutics we have for them. And thankfully, Omicron is not as bad. The big thing is that for the patients who are anti-vax, they don't believe that they're getting sick and they delay the care till it's too late, So that kind of goes hand in hand, which is very tragic, but, hopefully that'll get corrected. Did I answer your question, or did I spin it totally differently?
No, that was interesting to hear.
I mean, Arizona is kind of like, it has always been different. We've had a lot of, early on in the epidemic, we saw a lot of Native Americans. It was heartbreaking. It was really heartbreaking. I'm working in a suburb like Glendale, and we would get patients airlifted from the reservations directly to our hospitals, and not only our hospital, but throughout the region. That's how high those numbers were. But then they have their vaccination rates on the reservations are really good now. So mercifully, we're not seeing that. And then the government initially, they sent a lot of the newer antimicrobials as they were coming. They got allocated to some of the hospitals there as well. So from that's something unique, Arizona. So that's good. But the other stuff, yeah, there is light at the end of the horizon.
Yeah, of course. And then, kind of looking at the fact that you've been engaged for, the whole realm of the pandemic, and you've seen it from the start to kind of now where we are now. Are there any kind of lessons, either small or broad, that you have kind of taken away or that you've learned throughout all of this time, or that you've kind of put into your work now that you weren't thinking about 2 years ago?
You know what, Emily? What I'm humbled about is you cannot predict who is going to get severe disease, which patient as you're admitting them, who's going to get severely ill and not. And that really humbles you. And there are two patients that'll get admitted. You'll do everything the same for them. One of them will do well and walk out on the fifth day. The other one will instead get upgraded to the ICU. It's heartbreaking, but it just keeps you so humble. And and it and throughout the pandemic, what really, I mean, there's been a core of medical staff in each hospital that has worked so in such a dedicated fashion that it just, I mean, it's amazing. And I mean, hats off and kudos to them. Yeah.
Yeah, well, oh my gosh, kudos to you and all of your work. You are definitely an enormous part of that, whole realm of being a doctor during this time. So huge thank you to you.
Thank you.
And also kind of just looking ahead and looking at the next 6 months, what will that this kind of look like for you? And especially with the fact that there might be new variants in the future and there's always the chance of new infectious diseases kind of looking your way.
I mean, nobody has a crystal ball, but so far as what we think, we so unless there's a new variant that really comes and upends everything, I don't think a, a booster is going to be recommended. But I do believe that in the fall, the flu and the COVID shot will be bunched together. I mean, I think that's what we are looking at right now. And again, because the antivirals are going to be more readily available, it's just not going to seem as bad. That's right now. Things really look hopeful. At least in Arizona, the numbers are coming down tremendously from where they were. I think they're down 70% down from where they were like just 14 days ago. So we hope this light shines. Summer's coming. We're hoping things are going to just brighten up and look good. Yep.